Welcome to the Editor's Podcast for the Journal of the Academy of Nutrition and Dietetics. My name is Dr. Linda Snetselaar, Editor-in-Chief of the journal. For this particular podcast, we will be discussing the effect of the COVID-19 pandemic on WIC participants and WIC directors in California. Dr. Shannon Whaley is Director of Research and Evaluation at the Public Health Foundation Enterprises, which is a program of Haluna Health. Dr. Whaley, thank you so much for being with us today.
Linda, thank you so much for inviting me. I appreciate being here.
I have just a few questions for you related to WIC and the pandemic. And so to begin, I wondered if you might briefly review the qualitative research design that you describe in the article in our journal. And the title of that article is A Qualitative Examination of California WIC Participants and Local Agency Directors' Experiences During the COVID-19 Pandemic.
I'm happy to, Linda. Thanks for asking. We have a wonderful partnership with the Nutrition Policy Institute. That's Lauren Au and Laureen Ritchie, Christina Hecht, and Marissa Tsai. Without this partnership between PHFE WIC, we're a very large WIC program in Southern California. We're a program of Haluna Health. Without the partnership between PHFE WIC and Nutrition Policy Institute, it's really hard to get research like this done because we on the front lines of WIC are really busy figuring out how to serve clients. And while we want to do all the research at the same time, having those research partners has been essential. So our research design grew because our team, those of us at PHFE WIC, which also includes Kat Martinez, Chris Anderson, and Martha Mesa, we are engaged in a quantitative study to look at the impact of the increase in fruits and vegetables to WIC families. And in the context of that, right as we launched, this thing called COVID happened. And boy, was that a surprise to all of us. So we happened to be in the field for another study, and we could quickly pivot, thanks to the partnership with NPI, to engage in this qualitative study where we could very quickly reach out to participants who are being impacted by the pandemic, doing basically phone interviews with 60 participants from my region in Southern California, 60 participants in the Central Valley area of California, and 60 participants up in Northern California. So we could get a snapshot of how participants were responding to the pandemic across the state. At the same time, we were really fortunate because there's 83 local agency WIC directors in California, and all of them were scrambling to figure out how to respond to COVID. So we were able to interview 22 of those WIC directors. So the paper that has come out in your terrific journal this month reflects the outcomes of those qualitative interviews with both participants and WIC directors to get their reactions and responses to, how's this going? How are you responding to COVID? How are these changes affecting you? And frankly, what's working? Because we know that for all the challenges that have come with COVID, there have also been some silver linings that have led to some positive changes. So let me stop there and see what other clarification questions you'd like to ask.
Thank you. And we are honored to have your article in our journal as well. I wondered if you might tell us a little bit about how COVID-19 broadly affected California WIC participants and local directors.
Sure. How much time do you have, Linda? It's quite a change, let me tell you. From February to June of 2020, we all know what happened in March. Participation in California's WIC program grew by 14%. That's more than 100,000 people in a 4-month period. So it was a very rapid increase in the need to participate in the program. And at the very same time, WIC transformed from being 100% live service delivery program in WIC sites to a nearly 100% remote service delivery program. We all know in March, there were orders that we all needed to stay home, and California took that very seriously. So in the month of March, April, May, not only did California's frontline staff suddenly have to learn a completely new way of doing WIC business, but we had to enroll over 100,000 new people into the program. So It was a really big change very, very quickly. And here I just need to give a really special shout out to the frontline staff across the state of California and frankly across the country who managed to transform WIC literally overnight. We sort of joked that we were building the plane while we were flying it. But what it really required was creativity, technology. You really all of a sudden needed to learn to use the phone and these funny video conference things that we all of a sudden learned how to use. All of a sudden we all know what Zoom and Teams are. So it really transformed California WIC very, very rapidly. What I think is important to note is this all was possible because of the public health emergency and because the federal waivers were released very quickly. And what the reason that's so important is that physical presence has always been a requirement when you certify for WIC. So every year we need to physically see you. What the waiver did, it has enabled us to waive the physical presence requirement so that we could get proof of who this person is by phone, texting their information, emailing their information to us. Most people on WIC are also on Medicaid, which in California we call Medi-Cal, and that makes you adjunctively or automatically eligible for WIC. So it really streamlined. I go back to that silver lining. COVID really streamlined our ability to get people on the program quickly at a time when they really needed it. And frankly, now 2 years later, all those people who came to WIC, our caseloads are just the same as they were 2 years ago after this big increase in participation. So clearly what WIC has done over these 2 years is working. I just want to share, as you can read in our qualitative paper, the quotes from both participants and from directors are extremely positive. Just the ability to provide WIC services remotely has enabled moms, frankly, to stay at work. Many moms couldn't get time off of work to come to the WIC site. Now we can actually do that WIC contact remotely, enabling her to stay at work. Lots of different wonderful quotes that I kind of want people to just read the paper and not just read them all on this podcast, that really came forward from both directors and participants about how much they appreciated the ability to have remote services. Just in closing on this question, though, I do want to say universally, both from participants and from directors, we heard that as it becomes safe to do so, a hybrid model of WIC services is really what's desired. People love the ability to do lots by phone and by text and get information. That's what this generation uses. They use their telephones. They get information through their phones. They love that, but there's also a sense that we want a hybrid model. There are many times when it's important to see people live. We want to weigh and measure kids. We want to make sure kids are looking healthy. We want to talk to moms and see them while they're pregnant. So the long answer, sorry about that, is what emerged really clearly in this literature is a hybrid model is really desired. So let's try to maintain some of these waivers, even after the public health emergency ends, please. Well, hopefully that will end one day. And at the same time, let's also, as we can open our doors, remember that many families do love to still come to the center and see the nutritionist live.
Thank you. Beautifully presented, Shannon. I wonder too, I know that as is true of many areas following the pandemic, what impact did it have on WIC policy as you think of moving forward?
Yeah, such an important question, Linda. Really important right now because our public health emergency, I'm not going to get the dates right. We're good for a little longer here. But when the public health emergency ends, and frankly, we all want it to end. We all want to reach a point where we don't need it anymore. But when it ends, those federal waivers are tied to it. So the concern is that then physical presence waivers would go away, and suddenly we'd be required to see people live, even if we're not really at a point where we can do that again for 100% of the participants all the time. So I think WIC policy moving forward, the two really big things we need to keep pushing for is to make permanent the ability to do remote services, which again, going back to my last point, doesn't mean we never want to see people. That is not it at all. But we need to put into policy moving forward the flexibility that enables a mom to do some of her WIC remotely, some of her WIC in person when she's able to, all of us want our moms to be able to stay at work. We want our moms to be able to do whatever they need to do in their lives and keep getting the important nutrition support from WIC. So policy moving forward, we want to continue to see this waiver of physical presence and the ability to issue benefits remotely. So here in California, almost every state has now moved to a WIC card. Those paper checks of the old days are almost gone everywhere, and they will soon be gone everywhere. But what that WIC card does is it enables us in California to remotely load the WIC card. Some states have a WIC card that require the participant to physically come in and swipe the card in order to load the card. What we saw is those states that did not have the ability to do that remote loading saw declines in participation during COVID. Those states where you could remotely load the card saw increases. So that also tells you that the remote issuance of benefits, boy, does that streamline the process and make food available to families who need food. So those, I think, are really key policy points moving forward that are being talked about widely. And anyone who wants more information, I really encourage them to look at the National WIC Association's website. They do an excellent job of really talking about what the policy asks should be.
Thank you. So important as we move forward in this effort, and incredibly interesting what effect a pandemic can have, where there indeed may be some positives. So thank you for that description. So how might this research affect the way in which RDNs who are practicing in, say, a community setting counsel their clients or participants? And what do you see as the effect, in particular, some of the things that you write about in the article? What kinds of things might result?
Great question. And I want to start by saying that I am not an RDN, and I love all of you RDNs, and I'm delighted to work with hundreds and hundreds of RDNs. So I'm going to speak from my position as a person who works with lots of them and who works in the WIC program. And I'm going to honor any RDN who wants to jump in and expand on this. But what I have seen from this, again, I keep calling it the silver linings of COVID. I have seen a team of RDNs do what they all do so well, which is just be so flexible and learn as they go. And I think specifically what we've seen with the pandemic really is this transformation into what many call a telehealth model, when you think of sort of the broader healthcare system. But I have seen RDNs every day sort of transform what used to be a live practice where they could see and touch and hold a baby. And I have seen them transform those skills to be able to do them remotely. And I think that has been amazing to watch. It comes with drawbacks. It's really tough, for example, to do breastfeeding counseling over the phone when I can't see the latch. And this again gets both to RDNs and our whole IBLC community of lactation support. Some things are very difficult to do remotely and are just so much easier to do live. But I think a huge impact on the RDN community within our community setting of WIC has been their really graceful transition into being able to do hard work without seeing the client. So I think probably that's the biggest impact. And that's how I hope our research and continued research, this I guess would be a call to action. How can we support RDNs in this virtual world such that we feel like we have high quality services continuing? And, because what we're hopeful in the future for is a WIC hybrid model, if we could start to identify with the RDN community, which services really are most important to do live and which ones can we do remote? I think that provides just such a wonderful policy landscape for the WIC program to say, okay, these appointments, we really want to move back to the live format whenever possible. But these types of contacts, whether it be a child mid-cert at 2.5, or once the infant's over 6 months, maybe there's some contacts that really lend themselves better to telehealth. So I think there's so much opportunity for research in that area. And I hope our research sort of gets people thinking about that. I'm not sure I answered your whole question there, Linda. So let me know if I missed a part.
I think you did a beautiful job, and it's wonderful for RDNs to hear from those who aren't RDNs about sort of the way in which they have worked throughout this pandemic, and your observations, I think, are just really on target. Thank you so much. I so appreciate your sharing this information with us today, and also want to commend you on your leadership in this area that is so important, and that, as you are saying, will be experiencing probably policy changes as time goes on. But the wonderful kinds of things that have happened in a very difficult kind of situation are I think very important for the membership at the Academy to hear. So thank you so very much. And we appreciate your time today.
Thank you, Linda, for having me. We love the journal. We love who reads it. So to anyone listening to this and anyone who reads our paper, thank you. And please reach out, because we always love hearing from you in the community. Our work gets better because we hear from you. So thank you, Linda. I appreciate the invitation.